Now we're in the lower leg. So these muscles are going to cross the ankle joint and onto the foot bones or toe bones. So these muscles are going to act at the ankle to move the foot. So we can use ankle or foot interchangeably. But first off, just sitting right on, you can see that some of the tibia here, right? But on this anterior side of the tibia, this muscle, right front and center, is your tibialis anterior. And there's the action that it produces. Remember, dorsiflexion is raising your foot up towards the ceiling, your toes and foot up towards the ceiling like you're standing on your heels. That's dorsiflexion. And also inversion, which means turn your foot inwards so the soles are facing each other medially. So there's your two actions of your tibialis anterior, dorsiflexion and inversion. And we don't have to say at the ankle or of the foot, because that's the only place where dorsiflexion and inversion happen, is at the ankle or at the foot. Right, then you'll see extensor digitorum longus, and this is nice, kind of like in the forearm. A lot of these muscles are named after their action. Extend the toes. Digitorum also means fingers, but since we're in the lower extremity here, digitorum has to do with the toes. So extensor digitorum, there's a longus and a brevis, right, which is a long and a shorter muscle. Brevis is not on the lab list, which is why we only have longus here. So those are your toe extenders. Of course, you can see a picture of it here. Kind of hard to see. You don't see a whole lot of it there. And then we have a muscle that extends well, remember chapter 1? Hallux means big toe. Well, hallucis is the muscle form of big toe, so extensor hallucis extends the big toe. And, well, there's a longus and a brevis, only one's on the lab list. And so kind of similar to the extensor pollicis for the thumb, right, in the upper extremity. Well, here's a muscle, there's actually two, the longus and the brevis, the long and the short muscle, that's named according to its location. You may recall the fibula, which is not pictured here because it's covered by muscle. Fibula is the lateral bone of the lower leg. So sitting right on the fibula, we name that muscle the fibularis muscle. And most of what you see is fibularis longus. At the bottom, you see a little bit of brevis on either side of the tendon. So there's your fibularis longus and brevis. And if you look at the action, it's the exact opposite of the tibialis anterior. So tibia, fibula, tibialis anterior, fibularis longus and brevis. When one's the prime mover, the other is the antagonist, right, and vice versa. So you might recall the tibialis anterior performed dorsiflexion and inversion, while the fibularis muscles perform plantar flexion and eversion. Plantar flexion, if you stand on your toes, right, that would be plantar flexion, or point your foot down towards the floor, that's plantar flexion. Eversion is moving, I can't really show you on this picture, but eversion, you can refer to chapter 9 if you want pictures of all the actions. Eversion is you're turning your soles outward towards the sides. Now we're on the posterior compartment. So we're looking at the back or the posterior aspect of the lower leg, which is your calf muscle. I typically call them calf muscles. And we see one large muscle right here with two heads, a medial and lateral head, which becomes the Achilles tendon, and the Achilles tendon inserts onto the calcaneus. So when this strong muscle contracts, it's pulling up on the calcaneus, which brings you up on your toes. It kind of brings you up on your toes, and then sort of inferior and deep to the calcaneus. You can see it on either side of the Achilles tendon. If we look on this picture, it's kind of right here, it's deep. Both those muscles together make up the calf. So the calf would be the gastrocnemius. Gastro means belly. So it's the belly of the calf, right? Gastrocnemius, and then sort of deep to it, which we can see a little better from the side view, right, is the soleus. So they're acting together to plantar flex the ankle or foot, joint, or the part of the body that's moving as a result of using that joint, plantar flexion. And that's its its prime movement. All right, to finish off this this PowerPoint or this chapter, some posterior muscles of the lower leg here. You may recall tibialis anterior on the front side. It performed dorsiflexion and inversion. Well, the tibialis posterior, since it's on the back side, it's going to plantar flex, but it's still going to invert, just like the tibialis anterior. Why? Because the tibia is medial, right? So inversion's pulling the sole of the foot medially, whether it's from the front or the back. So tibialis posterior is plantar flexion instead of dorsiflexion, and inversion, that's its action. And then we're just going to end with two muscles that you'll find labeled down here that are named after their actions, like a flexor digitorum, flexes the toes, flexor hallucis, flexes the big toe, like you can see here in italics. Both of them are longus, so that means there is a brevis, there is a short one right next to it, but since it's not on your lab list because it's hard to find on the models, we don't include it here. So those are all the muscles. So starting with slide 12, it's good to know the groups of muscles, the actions of course, but also the groups of muscles, like what are the muscles of mastication, respiration, rotator cuff muscles, the hamstrings, the quadriceps, and then even by action, which muscles are the hip flexors, for example, knee flexors versus knee extensors. You could be asked what the antagonist of a muscle might be, which would be a muscle that performs the opposite action of a given muscle, right? So a lot of information, right, to know for this chapter. Of course, the first 11 slides were we weren't naming muscles, we were looking at their fascicle arrangement, right, and so on. But I'm kind of looking at the time, and it's over an hour and 10 minutes of just my voiceover, which is almost identical to one of our lectures, so it kind of worked out really nice. Please email me if you have questions, and